Hi, everybody. It's Ronda Cobb, the money coach, and I am so excited to be here today. And the other thing I'm excited about is finally, I know I've been saying this for a few shows. Check out the new website. Well, the new website is actually really, truly live now. So go check it out. Click on contact us, give us your feedback, tell us love it, hate it, change this, you misspelled that, whatever you see, whatever it needs. Feedback is so good. So go see the website, rcmoneycoach.com. And of course, if you need to suggest an idea for a show or you just need some help and you don't know where to turn, send me an email, Rhonda, Ronda, at rcmoneycoach.com. All right, onward. A couple months ago, we were in the throes of open enrollment for health insurance and the annual enrollment period for Medicare, right? You remember that? You got 5 million phone calls every single day. How could you forget? But this busy time of the year is marked by many things, among them those phone calls, but also confusion and frustration, unrequested and unwanted phone calls, false advertising, and anger. I talked to so many people, and I ran a number of quotes for people in my area who wanted to look at a plan, either Medicare and or under 65, not Medicare. And there were not very many of them who weren't confused or angry, but they managed to be much better consumers by the end of our conversations because you know me, I have to explain things honestly and truly. So I'm glad I can help them. But what about everybody else? With premiums for a family of four over $1,000 a month, with a $10,000 deductible for the year, that means that the average family of four is paying well over $22,000 before any coverage actually kicks in. Then don't forget, after the coverage kicks in, there are still copays. Wow, wow, and double wow. Or should I say, ouch, ouch, and double ouch? And for the Medicare set, the premiums for an Advantage plan are really very low and competitive. But that doesn't mean they're free. The copays, which factor into the policy's maximum out of pocket for the year, also known as the MOOP, maximum out of pocket, MOOP. So remember, if you hear the word MOOP, that's the maximum out of pocket for your Medicare plan for the year. Anyway, so those figure into for just everybody. So, you know, you have to look at that because you don't know the true cost of the plan if you don't look at what these copays are or what the MOOP is going to be. And there are copays and deductibles for the prescriptions as well. So if you are not already retired, be aware that medical expenses are high, even with Medicare. And these knuckleheads in politics and on social media who want you to believe that Medicare is free are misleading you tremendously. It isn't free, and it does not cover everything. Now, of course, you know by now, that got me to thinking. And here's what I'm thinking. I wonder if we wouldn't be better off financially and health-wise if we jumped off the bandwagon. You know, the bandwagon that says we should surrender our health insurance and healthcare choices to millionaire bureaucrats, billionaire hospital administrators, and even bigger billionaire insurance companies instead of ourselves. That bandwagon. Do you feel like your health insurance premium is wasted money? And would you rather manage your own health care? Well, let's explore this topic together. I think you'll be surprised by some of the results of that exploration. From my viewpoint, and factually speaking, both health care and health insurance are consumer commodities. Just like cars, houses, car repairs, and other extremely expensive items. I don't really know if health care is a human right, but it appears to be a human need for many people. Unlike the other expensive items in our lives, we shop less for health insurance and definitely way less for health care. Can you imagine, just for a minute, imagine being told by your car salesman where to take your car for service, that they didn't know how much it would cost, and that you had to utilize that service center because they said so, and that your warranty wasn't going to cover the cost of manufacturer's defects. You'd be pretty ticked off, right? What if the salesman also didn't provide any empirical proof or reason for the service or repairs, didn't provide an estimate prior to the repairs being started, and in other words, you drop your car off without any idea of when it was going to be done or how much it was going to cost? Then when you go back to get it, they say, "Oh, we had to call in a master mechanic from another shop, so you had to pay for that person, that shop fee, and extra parts on top of the bill from the shop you were sent to in the first place." Would you be a little bit frustrated? Of course you would. Yet, that is exactly how healthcare works. The salesman, also known as the doctor, sells you on an expensive test, preventative screening, vaccine, or procedure with little or no explanation outside of, "You have to have this done, and here's where you have to go." There's no upfront justification for the procedure, no estimate of the costs, either written or verbal, no reassurance of the outcome, no explanation of the risk or the benefits in many cases, and no preparation other than a printout telling you when to show up and where. But they say, as they dash out the door to the next patient, "The nurse will give you all the information." Right, as if she's not busy too. Then when you get there, you're expected to sign a document that says it gives them the ability to do whatever the salesman, doctors, feel necessary and to charge whatever they feel like charging. But you're not allowed to read it first and you're not allowed to edit it. They just stick it in front of your face and say, "Sign here." There is no standard fee book, no poster, and no disclosure. If you have insurance, each carrier negotiates differently with the hospital or provider to get the lowest pricing available to that carrier. The remainder of the bill will fall to your deductible, and instead of putting the negotiated price on the bill, they put the full price on the bill. That way, you pay your deductible percentage on a price much greater than what the insurance company paid on their part of the bill. And this maximizes the provider's profit on the procedure. Further, history shows us that mandated insurance does not improve coverage or reduce costs. Quite the opposite, in fact. Plus, more than 76% of people were opposed to the Affordable Care Act. Yet, it passed anyway, didn't it? I kind of wonder who paid for that. Huh. Anyway, I think we did, and we still are, to be honest. And here is where you need to draw your own conclusion. I can't tell you what to make of that part of the conversation. But let's talk about some ideas to help you save money without foregoing care you may truly need. And I will leave you to ask sufficient questions to determine if the care being recommended is a need or is a want on the part of the salesman. You ready? Okay. First, it helps to know before you go what the prices in the area may be. Now remember, we've had Dr. Hennessy on our show a couple times. He's the founder of Prater. It's a medical care price lookup tool. Now, why do you want to do that? Because it will save you money. If you're having a procedure You look it up, and you can go where the procedure is less expensive. This reduces your deductible or your copay, which comes right out of your pocket. So let's say the procedure is $5,000. It's a big thing. And your copay is 10%. Well, if you can find that same procedure for $3,500 by driving 5 more miles, you just saved yourself $150 in your deductible. That was worth the 5 minutes it's going to take you to go online and look it up. Don't you think? It's pretty good. So that reduces your deductible, your copay, but it also reduces the overall expenditures of healthcare spending. If you have traditional insurance or even Medicare, this is still important because spending impacts the cost of premiums in the next year for traditional insurance, and for Medicare, it impacts the cost of the deductibles for the next year and the year after that, and it impacts the longevity of the program. The next thing you can do to save money on health care is to resist the temptation of the commercials. If you don't really need the newest drug, don't get a prescription for it. They are the ones that are the most expensive, the least tried, and the least likely to be covered under your insurance plan. Don't hear me wrong now. I said if you don't really need, okay? Now, if you can truly survive without the new one, great. But if you cannot, that's an entirely different discussion. This is not a discussion to replace medical care. This is a discussion to save you money. You have to decide with your doctor, do I really need that thing that I saw on TV? Sounds so good, but you're going to pay for it. Next, try to get your doctor to follow your insurance plan medicine formulary. Now, a formulary is a little booklet that contains all the medicines that that insurance plan covers, and it tells you how they cover them. Is it a tier 1, which means it's a generic, it's the least expensive of your copays, sometimes even 0, or a tier 2, which is the next level of generic, or tier 3, which is your first level of brand names, tier 4, your expensive brand names, and then tier 5, these are your specialty medicines, your compounded things, things that are made one up just for you. Each one of those tiers has a different reimbursement level from your insurance carrier. So the formulary is the book that says which ones are which. Well, if you could give this book to your doctor, they could participate with you to prescribe the least expensive, effective medication that they can. By doing this, you could end up saving thousands per year. Now, to get a copy of this formulary, just call the 800 number on the back of your insurance card and ask them to mail you a paper copy. And yes, it's available online, but maybe you don't want to go online or your doctor just doesn't have time to go online. If you give them the paper copy and ask them to put it into your chart and tell them that you are on a strict budget and you need to control costs as much as possible without negatively impacting your care, then the doctor will have it immediately available at their fingertips and they can help participate in your care, both health and wealth. Now, another way to save money on healthcare is to resist